Welcome to the MamasteFit Podcast. In this episode, we have Dr. Brittany Henderson, who is going to be talking all about the importance of your thyroid when it comes to fertility, during your pregnancy, and then even in the postpartum phase. Welcome to the MamasteFit Podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit Podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit Podcast. In this episode, we have Dr. Brittany Henderson here, who's going to talk all about your thyroid, how it impacts fertility, pregnancy, and the postpartum. I had thyroid issues during my preconception phases that may be attributed towards some recurrent miscarriages for me. And so this is something that I'm very passionate about learning about, and I'm really excited to have Dr. Henderson here to chat all about it with you. So thanks so much for being here.
Thanks so much for the invite. I think this is a really important topic of discussion for people and one that isn't always talked about. So thanks for inviting me.
Yeah, can you introduce yourself to our listeners so they understand your background and why you are the expert in this topic?
So my name is Dr. Brittany Henderson. I'm dual board certified in internal medicine and in endocrinology. And previous to my current practice in Charleston, South Carolina, I ran the thyroid program at two major medical universities, Duke and Wake Forest in North Carolina. But I really was passionate about thyroid care and about helping people, and really think that the best way to do that is to bridge conventional and functional medicine for people who have thyroid disease. So in 2019, I opened up my own practice. It's called the Charleston Thyroid Center down in Charleston, South Carolina. We only treat thyroid. We have a lot of women. Women make up like 10 to 1 women to men in our practice. It's because thyroid disease affects women way more than men. And we also have recently bridged into more of the telemedicine realm. So we actually see patients in multiple different states all around the Southeast U.S., as well as Arizona and Minnesota, and just really trying to promote thyroid wellness, promote thyroid education for women and men, and then just do it right for people, because people are not treated correctly. And we really think that there's only one right way to treat the thyroid and to manage it.
Well, I am definitely really excited because I think I'm going to learn a lot in this episode. So let's start with preconception and fertility. So for my own experience, which is not all of our listeners' experience, but we've had lots of folks DM us and be like, that sounds like my story as well. I have hypothyroidism, so my levels are on the lower side. And excuse any of the terminology that I use that is incorrect, because I am not an expert in the thyroid. I'm just kind of repeating information that my provider has told me. So if you know the correct terminology, please correct me. I also have elevated thyroid antibodies. I think it's called TPO. And I had 2 back-to-back miscarriages between my first and second child. And so after my second miscarriage, the provider that I was seeing offered to do a bunch of blood work to take a look to see, can we figure out if something is going on? You don't have to have a third miscarriage for us to start suddenly caring about, is there an underlying issue that we can address? And so she found that I had elevated TPO levels, and she was like, hey, there's some research that supports that this could be related to recurrent miscarriage. And so I Googled, and I was like, what can I do for elevated antibodies? And it was, of course, this list of all of these bad things that are happening to you. But they offered some different supplements that I could take, like selenium and zinc. And so I pretty much just ordered everything and started taking it all, in addition to adjusting my diet to the autoimmune paleo diet for about a month. And then we conceived our son. And so can we talk about preconception thyroid health and what folks can be doing to try to optimize the thyroid health. And then I also know that there's a difference between like the normal levels and like optimal levels for your thyroid as well. And the way that my new provider has explained it to me is that the measurements that they use to like look at different thyroid things is like a lot more precise now. And so those normal levels are like really, really broad when they can be so much more narrow. So I know that was a lot for
I feel like it also could be helpful to just describe what the thyroid is and what the thyroid does before jumping into what it could cause if it's not functioning optimally.
Yeah, I mean, okay, so the first thing is thyroid affects a lot of people, a lot of women. And I said that like it's 10 to 1 women to men. We don't understand 100% why that is, but probably has to do something with like the X chromosome and where the genes that increase your risk for hypothyroidism and Hashimoto's are. So Hashimoto's disease is the autoimmune process that basically starts attacking the thyroid as not part of you. And because of that attack over many years, the thyroid stops working at 100%. That's the most common reason why people develop thyroid disease. But other people can develop like something called Graves' disease, which is a hyperthyroid part. It's an autoimmune part where the immune system basically tells the thyroid to secrete extra thyroid hormone and the person becomes hyper. That can also affect fertility. And then there are a lot of people who've had their thyroid removed for both like benign nodules or for cancer. So all of those people are kind of in a boat where this can affect fertility, this can affect preconception, management. The thyroid disease actually affects over 20 million Americans right now. It's like 1 in 8 women. It's probably more than that. And there are many people who have been undiagnosed with thyroid disease for many, many years. And one of the reasons for that is what you just mentioned about the reference ranges for normal TSH and normal thyroid levels being too wide. The reason that they're too wide is because when they established what a normal TSH is, they took 20,000 people and they did a blood sample for everybody and checked everyone's TSH. And then they came up with the normal reference range, which on most labs for a TSH is between about 0.4 to 4 or 5. That's way too wide. A normal TSH typically is around 0.5 to 2, 1 to 2 is normal. But the reason they found such a wide interval is because when they looked back at those blood samples 3 years after that study came out, 20% of the people that they included as normal actually had underlying Hashimoto's disease or thyroid disease that was not diagnosed, and that really skewed the results. And TSH is not the only thyroid number that should be checked when somebody is trying to get a diagnosis of thyroid disease. There are other hormones like free T4, free T3, reverse T3. There's so many different thyroid levels that as part of a complete panel can help a provider actually diagnose a person way earlier than when the TSH goes up or out of range or down or out of range. So diagnosis is a big thing. But back in 2002, I think ACOG, which is like the OBGYN, their guidelines suggested that not everybody who wants to get pregnant, not everyone needs a TSH screen or a thyroid screen. And that, I think, has been detrimental to a lot of women trying to get pregnant because if you don't check for it, then you wind up either having fertility issues or with recurrent miscarriages. And all of those things are really associated with the fertility process and with getting a successful pregnancy. And I can talk about why if you guys want me to.
Oh, yes, absolutely.
I'm curious.
Yeah, so I mean, the thyroid it sits in the neck. It's really important in many bodily processes, in all bodily processes, because there are thyroid receptors throughout the whole body. So thyroid hormone is one of the major endocrine hormones in the body. It not only affects, fertility, but it affects your weight and your mood, and it causes extreme fatigue when it's not working properly. It affects your digestive system. It affects your bone health, everything, pretty much everything. But fertility is a major process that it affects. And one of the main reasons is because it affects your female hormones and your female cycle. the thyroid and the female hormones go hand in hand. So when the thyroid is off or when it's not functioning properly, you can get abnormalities in like when you ovulate, and you can get poor egg quality and too much estrogen, which can mess up like how your ovulatory cycle happens. And then with what you said about having positive TPO antibodies are one of the antibodies we see in Hashimoto's, which is that autoimmune process. What that does when the autoimmune process is going on in the background is it can mess up how the thyroid functions, number one. And also the immune system, when it's not normal, can mess up embryo implantation into the uterine wall and basically cause the mother to reject the fertilized embryo. So getting antibodies to come down, reducing inflammation is also really super important, in addition to optimizing thyroid function and thyroid levels with your thyroid provider. So both of those things, the immune system, really important to manage and to try to get healthy. And then the thyroid replacement medicine, if somebody needs thyroid hormone, needs to be optimized, both the T4, the T3, the reverse T3. There's so many different things that go into that. But I have so many people in our practice that have tried for years with fertility doctors and IVF and IUI, and we get their thyroid numbers right, and then they get pregnant spontaneously and they carry to term. So it's like a huge, huge part of fertility that's really not talked about very often.
Yeah.
I feel like I was very fortunate with the providers that I had, that they were like very willing to do all of the extra blood work, especially for all the additional testing with the thyroid levels as well. I felt like I never had a fight for it, but I know that some folks do have to like argue to get blood work done. What would your recommendation be for somebody that is maybe struggling with fertility, or they're in their preconception phase and they're like, hey, I'm getting ready to try to conceive and I want to kind of set myself up as best as possible? Like, how would you recommend that they request like a thyroid, like a full thyroid panel, but also like not every provider is reading it correctly. So I think like the best solution would be just to see you virtually or in person. But like, how would you recommend somebody ask for like a full panel to assess their thyroid level?
Yeah, and I think it is provider dependent. The reason for that is because some of the guidelines are antiquated. They're like 20, 30 years behind the times, and they only recommend a TSH as a screen. And some providers just stick to that. They don't actually read the latest literature. They don't think outside the box. So finding a provider that you can work with is very important, and somebody who's open-minded and can actually, work with you as a partner in this process. But what I would do is ask them if they could run a full thyroid panel, and that includes a TSH, a free T4, which free T4 is basically the inactive thyroid hormone that the thyroid produces, a free T3, which is your active thyroid hormone. I always do a reverse T3, that's inert thyroid hormone. That helps me with dosing and things. And then thyroid antibodies. That's a really important part, because you may not have abnormal thyroid levels. You might just have positive Hashimoto's antibodies, because those antibodies, they start attacking the thyroid gland for many years before the thyroid loses function potentially. But the antibodies, like I said, have a huge effect on implantation of the embryo into the uterine wall. They can indicate that your immune system may reject the fetus and then lead to recurrent miscarriage. So it's important to also ask for those antibodies, particularly if you have a family history of thyroid disease. Ask your mom, ask your dad, ask your siblings and your aunts and uncles. And if you have a family history of it, it's a higher risk of you having it as well. And the antibodies to ask for are TPO, thyroid peroxidase, TG antibodies, thyroglobulin, and then I like to look at TSI in young people. That's a stimulating immunoglobulin, but all of that would be ideal going into a pregnancy where you have a strong family history of thyroid disease, because you could avoid years of infertility. You could avoid recurrent miscarriage if you actually address that prior to trying to conceive.
Let's take a break to talk about our sponsor, Needed. Needed is a nutrition company that's focused on optimal nourishment during pregnancy, postpartum, preconception, and they have a really amazing prenatal because it's focused on optimal levels of nourishment during pregnancy, preconception, and postpartum, and not just the recommended daily allowance. We want to find a prenatal that has the optimal levels of all of the different nutrients that we need to not just support us during pregnancy, but if we do have thyroid issues, that it also has the levels for thyroid health as well.
So during my pregnancy, I'm currently pregnant with my fourth baby and I have hypothyroidism. I am taking needed prenatal multivitamin to help support not only my pregnancy, but my thyroid health in addition to their vitamin D and their omegas to help with the anti-inflammatory aspect of supporting my elevated antibodies as well. And so I trust needed to support me during my pregnancy. Roxanne takes them during her pregnancy and postpartums, and I'm going to continue to utilize them in the postpartum phase, especially knowing how important my thyroid is, not only for my pregnancy, but for the postpartum to help support breastfeeding and also to support my postpartum mental health as all of my hormones are doing all sorts of crazy things. So if you're interested in checking out Needed, you can check them out at thisisneeded.com and use code MamastePod to get 20% off your first order or 3 months of subscription.
That none of that is like taught in school. Like I'm in midwifery school and they're just like, yeah, you do a thyroid, you check their TSH and like, this is what the TSH is. And you're like trending. So like if the TSH is going up or down, like that's when you would be concerned and like address it. But otherwise, like, if it's between this range, you're good to go. But like also the thyroid's really important for literally everything.
Yeah, it's so important for fertility and for actually having a successful pregnancy. And you have to look at the full panel because TSH can go high and it can go high normally. If you're iron deficient or if you're inflamed, there's many reasons why a TSH goes high and many reasons I don't treat that. Even if a TSH is high, if the rest of the panel looks good, there's a reason for that. The body is an amazing thing and it compensates for things. Yeah. But the whole panel plus the antibodies is the most important thing. And if you can't get a provider to order that for you, there are ways to go on and order it yourself. There's something called Let's Get Checked, which is like a home test you can do. There's online labs that you can order your own labs from. One is called, what's it called? Is it any lab test now? Or I can't remember, but I'll give you that in the notes maybe if we can
we'll link
put
them
that
in the
up
show
for
notes.
patients. Yeah, but you can find ways to order this yourself if you can't find a provider to do it for you.
I think one of our health food stores in the area will do a full panel for you too, which is awesome.
I love that there's so many options now for people. Like obviously it's like out of pocket. So like if you can't afford it, that like obviously makes that not an option. But if you're able to afford like these just out of pocket labs, like a lot of places will give you that option to get like a thyroid panel, get a vitamin D level, omega-3 level. Like literally, I feel like almost any lab that you could pay for out of pocket is available to you, which is really nice. But then like you have the issue of like, you get these numbers, what do they mean? But could you then bring those numbers to a provider and then they can, like, they already have that to be able to address it? Or it makes it easier if they do like a telehealth appointment with you after getting these labs to be able to adjust or address the issues they're having?
Yeah, we're in 8 states right now. So, and we're trying to grow as well. So, and we ask people all the time, like, if you're in a state where we're not licensed, just go onto our website, mythyroiddoctor.com, and ask to be licensed in that state. We have to have enough people where it's, because it's a lot of work to get licensed. But if there are more people in a certain state, we will look at that. But that's why we're doing telemedicine, because it is so hard to find good thyroid help. We're also launching some educational programs for both patients and providers. You can learn more about that in our social media. It's Dr. Dr. Henderson, MD. But, if you can't find good thyroid help close to home, it does make sense maybe to look for at least a thyroid expert for a one-time consult before you get pregnant to look at your numbers and just make sure you're good to go.
Yeah.
It's called Walk-in Lab, by the way, the online lab.
Okay. Awesome. Are there any like nutritional things that you recommend to support thyroid health? So someone's working on getting their full panel, like maybe they're starting to take medication. Are there any because there was like a whole list of supplements that like when I Googled, they were like, take these 85 things and it helps with thyroid health. And I think there are even like certain like doctors that offer like, this is my thyroid vitamin. Are there any like general like minerals or vitamins that are really beneficial for the thyroid that someone could look to include into like either with their whole food diet or like supplementing potentially?
Yeah. So prenatal vitamins typically have a lot of the thyroid nutrients. Selenium is one of them. Selenium is a really good antioxidant. It helps with oxidative stress in the thyroid gland, and it also helps with conversion of T4 to T3, which is your active thyroid hormone. So typically we recommend anywhere between 100 to 200 micrograms mcg of selenium. You can get toxic with it, so you don't want to do too much. And most prenatal vitamins have, 50 to 100 micrograms. So supplementing with things like Brazil nuts. Brazil nuts are really high in selenium. 2 or 3 a day in addition to your
It's like a
prenatal
nut.
is not a bad idea.
Oh, that's the nut. That's the name of the nut.
Yeah,
Like
it's
it's called a Brazil nut.
Is like,
yeah,
okay.
it's the name of the nut.
Yeah. And the selenium content varies by where the Brazil nut was harvested because it actually concentrates selenium from the soil. So it's sometimes hard to, know exactly how many micrograms you're getting. So that's why sometimes people just supplement, but it's fine to do it with whole food. You want to also make sure you're getting enough iodine. Iodine's super important for thyroid function. The way that you make thyroid hormone in your thyroid is by taking tyrosine, which is an amino acid that you get from your food, and then adding iodine to it. And that's how you make T4 and T3. So you need enough of that. And you get it in seafood and seaweed and eggs. Eggs is like an awesome food for thyroid
It's like the
health.
ultimate pregnancy.
It's the ultimate one. Eggs is amazing. It's really, really, it's all about the eggs. But if you're intolerant to eggs, you obviously know, but
Yeah, don't eat it.
yeah, don't eat eggs. And then iodized salt, you can get iodine in that. You only need like a teaspoon of iodized salt a day. But sometimes when people have Hashimoto's disease, they have certain antibodies like thyroglobulin antibodies or TSI, where you don't want to do too much iodine because it can actually make things worse. So talk to your provider about whether that's appropriate, but you want about 150 to 220 micrograms of iodine, not very much. People who are at risk to be iodine deficient are people who are vegan or vegetarian, or if you don't eat eggs, you're at a higher risk. So just make sure that you either address that with your diet or test for it. Make sure you're not iodine deficient. The best way to test is with a 24-hour urine iodine. Doing a blood test for iodine doesn't make any sense because right after you eat a high iodine food, all the iodine rushes into your cells and then the blood test looks low. So don't do a serum iodine. It doesn't make sense.
That's good to know.
And then iron, super important. Lots of women are iron deficient. It's the number one vitamin deficiency in the whole world. And if you're a menstruating female and you're not eating a ton of red meat, or, if you have really heavy periods, you're at a really high risk for iron deficiency. Super important for your thyroid function. So making sure that you're testing for that, particularly going into pregnancy, because iron deficiency is a huge issue during pregnancy too. And then, just things like zinc and magnesium and all those little micronutrients and minerals that are probably part of your prenatal vitamin. And then when I talk about diet and Hashimoto's or diet and autoimmune disease, what you said you did autoimmune paleo, I think, correct?
Yeah.
Yeah. So that's great. I mean, that is basically taking all of the most common inflammatory foods that people with autoimmune disease have issues with and putting it all into one really hard diet because you're avoiding lots of different...
It is challenging.
So hard.
Yeah. It's a really hard one. But I mean, most likely, if you do that, there's at least 1 or 2 or 3 different food groups that your immune system has an issue with. So it does help reduce inflammation and it helps reduce antibodies so then you can get and achieve a successful pregnancy, a successful implantation of the embryo, and your immune system doesn't attack the fetus because it's completely skewed. So that's great. I always tell people eat whole foods, like not processed foods, not foods full of chemicals, not GMO foods, real actual food that grows in the ground. And then gluten, dairy are 2 of the more common food intolerances that people have. So if you're not going to do full autoimmune paleo, at least gluten, dairy free, sugar, get rid of that. And just trying to eat, mostly vegetables, mostly plant-based, but lean proteins are good too. And food that's sourced from normal, healthy, not contaminated, not full of chemicals, not processed food. It's not rocket science.
Yeah, it sounds pretty straightforward.
But also, it's incredibly hard to do that.
Yeah, the autoimmune paleo diet was rough. We couldn't maintain it for a long time.
We are Korean. We love our rice. We are also a part Italian. We love our pasta and bread, and you couldn't eat any of that.
I mean, we could probably not do dairy, though. I think we're a little lactose intolerant.
We are dairy intolerant. We are lactose intolerant, but we still eat cheese and milk and ice cream. And we just suffer the consequences.
Yeah. I always tell my patients joy is really important too. So if that brings you joy, you go for it occasionally. But if you're trying for fertility and trying to get inflammation down, it makes sense to try your best. The other thing that we do with our patients so that you're not just guessing, because all these things are guesses, it's not everyone's immune system's the same, is that we recommend actual dietary antigen testing. So testing your immune system for what you're reacting to. And those are tests that are available. There's a whole, discussion about whether or not they're sensitive or specific or whether or not they're helpful. But we have specific ones that we really like that actually help us to hone in onto what your immune system reacts to so that you can fashion your diet for what is specific to you. It's personalized medicine. That's easier. Because not everyone has a gluten intolerance and not everyone has a dairy intolerance.
Is this something that you specifically have to order? Or is it like a company that people can do themselves?
There are online tests, Everlywell is one that people can order themselves. It's just an IgG test, so there's lots of false positives and negatives, but it's somewhere to start. Yeah. It's not very costly, it's easy. But the ones that we do are they're called lymphocyte response assays, where we take out lymphocytes from the person's blood test, put them in petri dishes, and then introduce 400 to 500 different foods, chemicals, dyes, additives. So we know what your immune system's reacting to and what you should be avoiding to help with inflammation. And that's something that your provider would have to order. Not all providers know about these tests or are part of the lab. So it would be somebody specific who knows how to do them.
So if we drove to Charleston, could we get...
Yes.
It's only 2 hours.
It's not that far. We're only an hour from where Duke and Wake Forest are. So I'm that's doable.
We have people all across the U.S. that come in just because it's so hard to find good thyroid care.
Hard.
Mm-hmm.
So let's talk about the thyroid during pregnancy then. So during this most recent pregnancy, my TPO levels were a little bit elevated during my preconception phase. So about 6 to 8 months before my husband and I knew that we were going to start trying to conceive, I started talking to my provider, who I see about once a month now for my thyroid. And I was like, hey, we're trying to conceive. What can I do to optimize my fertility? And so we started doing thyroid medication at that point because we were trying to see if we could do it without any medication, and my levels just weren't adjusting too much. And so we started some thyroid medication, and then we were checking my levels every single month. And 1 month, my thyroid antibody, the TPOs, were a little bit elevated. And so I was a little bit nervous, going into pregnancy, that this was going to be an issue. And fortunately, they weren't as high as they were with my recurrent miscarriages. So we're 17 weeks or 18. I don't know how many weeks am I now. 17 weeks now, and everything is looking really good. But I had another blood panel done during my first trimester, and it showed that the TPO was elevated again. And so I, of course, went on Google and was what are all of the horrible things that are going to happen? And it was preterm labor, your placenta's going to fall off. So it was mostly you're going to have your baby really early. Your placenta is done. And so I spiraled as it was, I think is understandable. So what role does the thyroid play during pregnancy, which I'm guessing is a big role? And why is this so important for someone like me and other people like me that have a thyroid that is not working as perfect as it needs to be? Why is it so important to continue to maintain thyroid medication during pregnancy? And I see my provider once a month. And so this is not my OB or my midwife. This is my PCM, who has been working with me very closely with my thyroid. Like, why is it so important to like continue to think about your thyroid throughout your pregnancy, especially if you have any sort of like pre-existing thyroid health issues?
Yeah, no, it's so important. So, preconception, the guidelines say get your TSH like 2.5 or below in order to reduce your risk for early miscarriage and fetal growth issues and everything else. Second and third trimester, the recommendation is 3 or less. In our practice, we really try to get people optimized. Between 0.5 to 2 is what the TSH recommendation is. And if you aren't able to get in with your provider right when you get a positive pregnancy test, there are some recommendations from like the American Thyroid Association to like double up 1 day a week on your thyroid medicine until you can get your thyroid levels done and see your provider. That's just because you really don't want a high TSH in early pregnancy. The reason for that is the fetus doesn't have its own thyroid until it's 10 to 12 weeks. So it's relying completely on your thyroid medicine for growth and development. So in that first trimester, it's really important for your thyroid to be perfect. We always tell people, if you get a positive pregnancy test, call us immediately. We're going to do your labs immediately. You are VIP patient. You're getting onto our schedule like this week or next, and we're going to make sure everything is perfect, for first trimester pregnancy. And then not everyone needs an increase in dosage. Most of our patients don't. They're really good going in. And then we watch them every 6 to 8 weeks because as the fetus develops and as the placenta grows, the placenta has enzymes in it. They're called deiodinase enzymes. They take your thyroid medicine and they inactivate it. So you sometimes need more because of that. And they also secrete growth hormones and things that mess up thyroid hormone metabolism. So very often you need a higher dose, about like 20 to 30% increased dosing just because of the placenta. The placenta does that on purpose because the fetus, when it's growing, there are times where it needs a lot of thyroid hormone and times where it needs no thyroid hormone in order for the organs and everything to develop properly. It's really cool. It's like a complete symphony of how it works. But, and also like as you go through pregnancy, you gain weight. So thyroid hormone is weight dependent and your dose goes up just because of that issue as well. We watch patients every 6 to 8 weeks really closely. Every 4 weeks is even better, just because we want to make sure we're on top of dosing changes and that everything is looking perfect, because it affects not only maternal well-being and maternal health, but also fetal growth and development. And we always are asking, like what percentage is your baby on your ultrasound scans. We want to make sure that it's not dropping or there's not fetal growth restriction, because if we're not dosing your thyroid medicine right, there is an increased risk for fetal growth issues and growth restriction. If the thyroid medicine isn't dosed right, there's an association with gestational diabetes and with high blood pressure during pregnancy and everything. So it's so important for not only the mother's health, but also the baby's growth and complications of the pregnancy as well. And then we also follow postpartum. Once you deliver, your weight will come down, the placenta is gone. A lot of times we give our patients a postpartum plan. So when you deliver, when you go home, you're going to start on this medicine and this regimen so that they don't come back to me 4 to 6 weeks later after giving birth and they're super hyperthyroid. That doesn't help anybody. That messes up your sleep. It causes depression and anxiety and everything else. So we go into the postpartum period with a plan of action. And then we watch patients very regularly postpartum as well, because it affects mood of the mother, and it affects breast milk supply if you're breastfeeding. Thyroid has a huge impact in prolactin, and those all hormones interact, but that one in particular is very sensitive to thyroid hormones. So we really try to get that right for people in the postpartum period. And then antibodies are a completely different thing. But the good news is once you get pregnant and you get through that early, gestational period where you're at a higher risk for miscarriage, everyone's at a higher risk for miscarriage in that first trimester. But once you get through that, into the second and third trimester, your antibodies typically will come down. And that's because pregnancy is a state of immunosuppression where the immune system quiets down in order to tolerate the fetus. And so we see a lot of people achieve remission for their Hashimoto's, meaning that their antibodies go into the normal range during that pregnancy period. And we're like, woohoo. And I always tell them, like, postpartum is a completely different thing. It's a wild ride when you deliver your baby. And we commonly see antibodies rise for about 9 months postpartum after delivery. In order to blunt that response, I always tell patients, be on top of your inflammation. Inflammation drives autoimmunity. So if you're giving birth vaginally or by C-section or whatever, if you have any tearing or inflammation, or if you have a scar and they did a C-section, you want to be on top of inflammation ASAP and try to blunt that autoimmune response with, anti-inflammatory vitamins like turmeric or curcumin or fish oil or vitamin D, and heat and ice, like easy stuff, because if you blunt that inflammatory response, you have a better chance of not going through the roof with your antibodies postpartum.
That is very, very helpful.
So I know a lot of providers will manage thyroid issues, like that they have enough knowledge to sometimes, like Gina just sees her primary care for her thyroid issues. When should somebody, what's the difference between seeing your primary care and an endocrinologist throughout your pregnancy, preconception, to manage your thyroid?
I think there are primary care doctors out there that do know a good amount about thyroid and feel comfortable with management. There are reproductive endocrinologists that do that as well, and OBGYNs that manage thyroid care. But you really just want to be with a provider that knows how to look at a full panel and really is watching you closely and trying to optimize those thyroid numbers. We do a lot more in depth with regard to nutrition and vitamins and looking at antibodies. And, we look at a lot of things, and that's just because we specialize in thyroid care, but not every endocrinologist does. So it's really just finding the right person. It's not even just about their credentials or, their subspecialty. It's about how comfortable they are with thyroid care.
Yeah, I do feel very fortunate with the provider I had. I think he used to be an internal medicine doctor and then transitioned to providing primary care. But he's very thorough with, he's looking at he's very thorough with what he orders for my blood work every month. And then he's very thorough with when he's looking at my results with explaining this is the normal reference range, but this is optimal, and this is what I'm looking for. And that's why, even though this says normal and you're good to go, it's not normal, and we need to adjust our levels. And so during my own pregnancy, we have increased my medication during the first half. I think I went from I don't know I should know my dosage. It was 25 probably micrograms or something, or
that's right.
And now it's 100. I think it was, maybe it's 0.25 to 1 or something like that. But it's we increased it 3 times or 4 times. 4 times during my pregnancy, and my most recent blood work came back that everything was quote unquote perfect. So that was reassuring for me with the elevated antibodies in the first trimester. And I know elevated, there's people that are really elevated, in the thousands, and then there's B, who is at 100, which is still above what it should be. But when he came back, was hey, your thyroid levels, other than the antibodies, were perfect. And so we're going to maintain your medication. If you feel good doing, adjusting your diet to help with the inflammation, that's fine. I'm not worried, but we're going to continue to check on it throughout your pregnancy. It was really reassuring for me. And I left the appointment feeling good. And so I think that's something that could also help folks figure out what is the best provider for them to help with the type of care that they're looking for. Is do you leave your appointment feeling good? Do you feel satisfied with I'm receiving good care? And if not, then we probably need to find a new provider. And that applies to every provider, your OB, your midwife, your endocrinologist, your primary care. If you're leaving feeling not great, then maybe find a new provider. Are there any signs and symptoms that somebody should be aware of as an indicator of a thyroid issue? Which I know is hard because during pregnancy, fatigue is also a big symptom. but it can also be a symptom of thyroid issues like dry skin, which could also be a pregnancy symptom. So are there any like key things that like you're looking for, or to let somebody know like, hey, you might want to go make sure that your thyroid is looking good?
Yeah. I mean, the first thing is the easiest thing is to ask your family members if they have thyroid issues, because it very commonly runs in family. It's not an exclusive thing. I mean, you could be the only one in your family with a thyroid issue, but if you have a strong family history, then go get screened. I mean, I tell my patients who have kids, I tell them if it runs strongly in your family, check your girls, especially when they hit 10 years old. Check them for the antibodies, because if you can catch it early and you can get on top of nutrition and diet and teaching kids to wash their hands and not get sick, you can prevent downstream issues with the thyroid, and you can prevent them from having to go on thyroid medicine. So family history is number one. Ask about that. And then I always tell patients, you know, the most common symptoms that people have are extreme fatigue. Everybody's fatigued. Everybody is tired. But this is a type of fatigue that's a little different. It's like if you get 8 hours of sleep and you wake up and you're still exhausted, that's not normal. There's something wrong. It could be thyroid. It could be something else like iron deficiency or something else. But it's worthwhile to start thinking about screening for a thyroid disease. And also if you have extreme tiredness in the afternoon, so thyroid hormone, active thyroid hormone goes lowest in the afternoon around 2 to 3. So a lot of my thyroid patients who are undiagnosed nap in the afternoon. They have to take a nap. And, you know, 20, 30, 40, 50-year-old people should not need to nap every day. You know, we're not 90 years old, and 90 years old should not have to either. There's something wrong there too. But that's a telltale sign that there probably is something wrong. The other things that we see that are associated with development of thyroid issues are weight changes, weight up or down. In kids and in teenagers, anxiety and depression. And that is because of fluctuations in thyroid hormone and in the antibodies contributing to anxiety, depression, heart palpitations, jitteriness, nervousness. It affects everything. But anxiety and depression is a big part of kids or young people and thyroid issues. And then, you know, GI issues, gut health goes hand in hand with autoimmunity too. Everybody has gut issues. A lot of people have gut issues, but constipation is a big one for hypothyroidism too. So I would say, you know, extreme fatigue, weight issues, which there are many reasons for difficulty with weight loss, but thyroid is one of them. And then, you know, GI problems, cold intolerance is another one, anxiety and depression in kids, those kind of things.
Roxanne, you need to go get your thyroid checked.
As I'm sitting here, like it's 60 degrees outside in a sweater. But our mom should get thyroid tested too. We are like our entire family has to wear sweaters inside. When it's like 7 degrees.
I wonder if it runs in our family.
He's just like sweating profusely because our house is at 72, and he's like, I can't even like walk down the hallway without just sweating, and I'm like shivering. So I should get my levels.
Yeah, you don't know how many like family members we have. I always tell them like, we're going to open a wing at the Thyroid Center for your family, because like we see everybody, and it's just because it runs so predominantly in families, so predominantly in women. But you can catch it early, and that's the whole point, is to like screen early so that you can do things to reduce the antibodies, get your immune system under control, and stop the progression of hypothyroidism. Because once you lose thyroid function, it's really hard to get it back. And that's when people have to go on thyroid medicine. The longer it happens, sometimes we look by our thyroid ultrasound. We do ultrasounds on all our patients. And, you know, after 15 or 20 years of autoimmune thyroid disease, some people have no thyroid left. Their immune system's killed it to the point where it's shriveled up and died, and it almost looks like they've had it removed. That's how crazy the immune system can be. Yeah. So super important to screen early is the key there.
So obviously we could talk about this for a really long time for our own selfish reasons, but do you have any like last advice for our listeners who are primarily pregnant and postpartum when it comes to thyroid health as a provider? Like, not medical advice, obviously, but any like words of wisdom when it comes to like the importance of the thyroid and what they can do to help to optimize not only their health, but also the health of their baby that they're growing, and then postpartum, like breastfeeding?
Yeah, I mean, first of all, be your own advocate for your health in all situations, but especially in thyroid, because it's very rare to find a provider that knows what they're doing, what they're looking at. That's because of poor education and poor guidelines and poor clinical studies. So be your own advocate, find a provider that you can work with that can be a partner in care for you. Secondly, screen early, screen before you're considering pregnancy if you can. Talk to your family members, screen your kids early when they hit 10 years old or if they're having symptoms. And then postpartum, it's a huge part of pregnancy, and it's a huge time when thyroid antibodies worsen. They can worsen for 9 months postpartum. So really looking at those antibodies in the postpartum period, even if you've never had antibodies before, just checking them to make sure that they're not coming up. And a lot of postpartum anxiety and postpartum depression is inaccurately diagnosed when it's actually Hashimoto's or postpartum Graves or postpartum autoimmune disease. So if you do have symptoms of anxiety, depression, and a family history of thyroid issues, think about that. Think about screening for those thyroid antibodies with your provider, because it could be that it's the thyroid and not anxiety or depression, and you might be treating the wrong thing. Biggest thing is be your advocate. If you don't think something is right, or you don't feel right, or you don't leave your appointment feeling good about the care you just received, seek a second opinion, a third opinion. Like, this is your life. This is the life of your baby. And, making it as seamless as possible is a big part of that, is finding the right provider to help.
Well, thank you so much, Dr. Henderson, for coming on the podcast and sharing probably a tiny portion of your knowledge about the thyroid and its importance during pregnancy and the postpartum. How can our listeners learn more from you if they want to schedule telehealth with you? We know that we're going to drive to Charleston to see you. Do you have any online courses and social media platforms that they can follow you on?
We do, yeah. So you can follow us on social media. We're on Instagram. We're on TikTok. Instagram handle is Dr. Henderson MD. It's Dr. Henderson MD. And then on TikTok, it's My Thyroid Doctor. If you want to see us in Charleston, you're more than welcome to come. It's Charleston Thyroid Center. We're in Mount Pleasant. And then also My Thyroid Doctor. We're located in 8 different states. If you go to mythyroiddoctor.com, you can see what states we're in and request your state if we're not licensed there already. And then we are launching patient-specific courses. One of them will be coming out in the next couple of months, just talking about the basic thyroid stuff, starting from what is the thyroid, what does it do, what are antibodies, talking through everything, including nutrition and diet and lifestyle changes, so that patients can be well-informed when they talk to their provider, but also well-informed about their disease state. So that will be coming up. We'll be announcing more about that in our social media platforms. And then we also, I didn't mention this, but I also wrote a book about this. It's called What You Must Know About Hashimoto's Disease. It's available on Amazon, and it's on our website as well, but it walks through a lot of this as well. And it's just a good resource book for you or for your loved ones to have if they have a thyroid condition.
Thank you so much, Dr. Henderson, for coming on the podcast and sharing all about the thyroid health during pregnancy, postpartum, before pregnancy. I learned a lot. I know Roxanne's going to go get her thyroid tested now because we are related. And she's
Gina has thyroid.
I'm the black sheep of the family. But thank you so much for coming on the podcast. We really appreciate your time.
Thanks, guys, for inviting me.
Thank you so much for listening to the MamasteFit Podcast. If you enjoy this episode, be sure to like and subscribe to our channel so you get notified whenever we release new episodes. We release a new educational episode every Wednesday and new birth stories every Friday.
If you're looking for more support during pregnancy, we have both prenatal fitness programs as well as a childbirth education course that's self-paced for you to work through as fast or slow as you'd like. If you're in the postpartum, we also have an education course for that to help prepare you for what to expect in the postpartum and as well as what to expect with your baby. That also comes with infant massage as well as infant and toddler CPR. We also obviously have postpartum fitness programs to help you return back to fitness or whatever sport you're looking to get back into.
If you're a professional and you want to learn more from us while earning CEUs, you can check out our online birth workers course or prenatal and postpartum fitness trainers course. You can use code STORY10 to get 10% off any of our online offerings, both our fitness programs, our online courses, and our professional courses. You can check out all of our courses online at MamasteFit.com.
This podcast is sponsored by Needed, a nutrition company focused on the perinatal time frame, and they're something that both Gina and I have utilized and recommend to all of our friends and family. And if you want to utilize them, you can go to thisisneeded.com and use code MamastePod to get 20% off the first order or the first 3 months of a subscription.